Good afternoon. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership at Harvard Medical School and want to welcome you to today's webinar, Harvard-affiliated Emergency Medicine Residency Programs. The mission of our office, Diversity, Inclusion, and Community Partnership, is to advance diversity inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. Today's program is a part of our Visiting Clerkship Program. For over 30 years, VCP, the Visiting Clerkship Program, has been a model of excellence, offering outstanding medical students, particularly those underrepresented in medicine, an opportunity to participate in HMS externships at our affiliated hospitals. Since its inception, close to 1,600 students have completed the VCP program. Unfortunately, during this academic year, VCP has been drastically impacted by COVID-19. We recognize that there is uncertainty in what the upcoming application cycle for residency will look like, as well as concern about the future and what it might hold. It's with these thoughts in mind that we decided to host a series of webinars to bring the members of the residency program, or Harvard residency programs, together with medical students to share ideas, provide support, and address questions on moving forward with the next stages of medical training and on the application process. This is our second webinar, and the goal is to, as I said, to bring our programs together. Today we have two Harvard-affiliated emergency residency programs, and our moderator will be able to tell you more. The moderator for today's program is Dr. Daryl Landry. He is an emergency medicine physician, an assistant professor of medicine, and an assistant dean in our Office for Diversity, Inclusion, and Community Partnership. Dr. Landry?
Good afternoon, everyone, and thank you for joining us for this latest installment of the Visiting Clerkship Program lectures on our various residency programs. We're excited to have this conversation where we share with you information about two of our emergency medicine residencies. We have an amazing group of panelists that are joining us that are going to help contribute to this discussion and hopefully give you as applicants insight and advice as you're preparing for the application process. I want to just say that we recognize the impact that COVID-19 is having on medical students, and it's unfortunate that we're not able to host students as part of the Visiting Clerkship Program at this time. However, we've developed these spotlight series to support students as a way to help them learn more about our programs, identify possible training opportunities, and hopefully identify opportunities for mentorship, guidance, and support as you enter into this process of going from medical student to resident. The goal of this webinar is to bring together our two Harvard-affiliated emergency medicine residency programs with medical students to provide insight and information about the residency programs, to answer some clarifying questions about the application cycle, and to help applicants feel more comfortable as they go about application through this uncertain time. Just to give you a couple disclaimers about our presentation, these are thoughts and experiences that are specific to Harvard Medical School, and we defer to the AAMC, the NRMP, ERAS, and other governing bodies for more information. All of your lines are muted and the chat function is disabled. However, you can communicate with our presenters through the Q&A section on the panel, and I will be happy to answer, bring about some of your questions into our discussion if we don't cover whatever questions that you may have. And then additionally, this webinar is going to be recorded and it's going to be available on the DICP website in a few days for your review. Next slide. And so with that, I want to introduce our wonderful presenters for the day. So first, I would like to introduce Dr. Leslie Bilello. She's an attending physician and the associate program director for the Harvard-affiliated emergency medicine residency at Beth Israel Deaconess Medical Center. Next slide. Next, I'd like to introduce Dr. Daniel Egan. He's the program director, incoming program director for the Harvard-affiliated emergency medicine residency program at the combined Massachusetts General Hospital and Brigham and Women's Hospital. Next slide. I'd also like to introduce Dr. Adaira Landry. She's an assistant program director at the Harvard Affiliated Emergency Medicine Residency Program at Brigham and Women's and MGH. Next slide. And finally, Dr. Carlo Rosen, who is the program director and vice chair for education at the Harvard Affiliated Emergency Residency Program at Beth Israel Deaconess Medical Center. And so with that, I will turn it over to both Dr. Rosen and then to Dr. Egan for them to just give a brief introduction about their residency programs. And then afterwards, we're going to dive into questions that are specific to the application process for emergency medicine. Dr. Rosen?
Thanks, Alden. So just a couple of quick sort of comments about the program. We've had the program up and running at Beth Israel since 1999, and I've been the program director during that time. I think what's unique about our residency program is really the structure. So we are a 3-year residency program, but you do have an option to do an additional 4th year with us, which is really sort of a design your own fellowship opportunity. So when you graduate from our program, you have 3 options. You can go right into community practice. You can do a standard fellowship, and we have most, if not all, the fellowships up and running at Beth Israel, or you can stay for an additional year of really academic time with us. The program is based at Beth Israel, Level 1 Trauma Center, Tertiary Care Referral Center. But the other unique aspect of the program is that you actually spend a fair amount of time at multiple community sites in and around Boston and in the Massachusetts area. It really sort of gives you an opportunity to see what emergency medicine and how emergency medicine is practiced kind of in the real world, not necessarily in the sort of academic centers, places where you have a diverse patient population and also have different resources, and frankly, not the resources that you might have at a major teaching hospital. We also have very well-defined roles because we are a 3-year program, so we have to pack a lot into 3 years. The 2nd year's function as really a resuscitation resident. We have a trigger system for the unstable patients in our department, and the 2nd year residents get involved with all the care for those resuscitations. As a senior resident, you take on a supervisory responsibility in the department as well. And then finally, we do have really almost any academic opportunity available. We do have over 50 full-time faculty that are all doing different research projects and can help mentor the residents. So that's sort of the nutshell for you about Beth Israel. And I think if you hop to the sort of skip to maybe the last slide, kind of summarizes everything. Go back 1 slide. There you go. That's sort of the bottom line, I think, that I've hit with most of the discussion.
Wonderful, Carlo. Thank you for a quick overview of the BIDMC HAMMER program. And next, Dan, if you would like to give us a highlight of the Brigham MGH HAMMER program.
Sure. So thanks for having me. So I'm excited to be taking over as the program director at MGH and Brigham. I trained here and graduated in 2006, so I've been away from Boston in New York City for the last 14 years. So I'm really excited to come back and come back to the place that kind of taught me how to be an emergency physician. I'm going to just talk briefly about my vision for residency training in general. I think first and foremost, it's about learning how to become an outstanding emergency physician. This is obviously the most fundamental skill that you need in order to go on and practice, regardless of where you ultimately go. And additionally, we have this responsibility to teach you how to be a lifelong learner. Much of medicine changes well after you leave residency, and so we have to give you the skill set to be able to do that for the rest of your career. And then lastly, to recognize that residency is one of the most challenging 3 or 4 years of your life. And so it's really important to train in a place that's attentive to your wellness, your well-being, and to provide that supportive environment that's going to give you the mentorship and the coaching and the advising that you need in order to be successful as defined by you and where you want to go when you're done. And as I'm coming into this program, my vision is to really continue to cultivate what I think is an outstanding academic environment where you will be have the availability of faculty that really have specialties in all aspects of emergency medicine, and to train the future leaders of our specialty, both clinically and academically, and to really continue to cultivate an environment of education where learning's at the forefront of everything we do, and to really expand on the diversity of our trainees and our faculty. We're a little bit different in that we're a 4-year program in the traditional format, and the 2 primary hospitals of Mass General and Brigham are both level 1 trauma centers, burn centers, with high acuity and really all the types of patients that you'll encounter. And then we do have a community experience at Newton Wellesley Hospital to give you that flavor of what it's like to not practice in a tertiary center. And similar to Beth Israel, we rotate at Boston Children's Hospital for our pediatric experience. I'm going to give Dr. Daryl Landry a chance to talk a little bit about some of the specifics, just because she's been at the program for the last several years and I've been gone for a while. And so Dr. Landry, if you don't mind taking over for me at this point.
Happy to, and I agree with what a lot of Dr. Egan said regarding our clinical environment being an amazing place to train. One thing though that I think stands out when I'm thinking about our Hammer residents is this incredible thirst for knowledge and innovation that exists within our culture. Our residents here really want to know everything, and not just for the sake of knowing it, but they really want to understand how they can change the status quo, how they can shake things up and be leaders in whatever field they want to go into. And so there's this constant cycle, I feel like, within our culture of being an advocate by to change the problem and actually taking some steps to create a new way of thinking about it. And you can see this actually in multiple ways. If you can go to the prior slide, we have various areas of interest in our department. I don't know if you can go to the prior slide, but in regards to ultrasound, research, policy, wilderness medicine, and many of these areas of interest actually have accompanying fellowships with them. And so I think the presence of fellowships, many fellowships within a department is actually relevant to residents, because it demonstrates that your department, that department, really invests in a deep dive for that area of interest. They have funded faculty members and fellows to really, really learn about that area. And so I think it's a great marker of dedication. Now, one other thing I want to talk about is that we try to really eliminate this flat hierarchy within our program. And one way we do that is by allowing residents to really speak up and form their own grassroots innovations. And so there are 3 here that I pulled out that I think really, really stand out and really define what Hammer feels is important. The first is Hammer Roots, which is a program that was, which is an organization or initiative, that was started by residents when they first started here as an intern, that focuses on the recruitment of underrepresented minorities during the application process. So a few residents came to me and they really, really wanted to take a lead here, and they've been very involved in interview season by reaching out to represented minorities. And the last 2 initiatives are based off of women's or gender-related issues, making sure that the faculty who identify as being a woman can relate to the residents as well. And last is this initiative Hammer Well, you see that in the middle, that is focused on increasing and sustaining the morale of our residents. So again, all of these are resident-related issues driven by residents that are trying to solve problems that they face on a regular basis.
Wonderful. And I want to say thank you to the program directors for joining us and offering in this information. I have a couple of questions that I just want to go through to make sure we get to the heart of the many concerns that students may have during this application process. But I want to first talk to you, Carlo, and get your perspective as a program director. So from your perspective, can you tell me how this is going to be a different application process compared to years prior?
So I think a lot is changing, has changed, and frankly, we sort of get new information daily now. I think the biggest changes in terms of this application season are obviously that that students are not going to be rotating, at sort of away rotations the way has historically been done. And so most students are going to be rotating at home institutions. and not have the sort of ability to go and look at other programs and rotate at other programs. I do think that it sounds like we're getting very close to having virtual interview season, meaning that people may not be traveling to go to other interviews at other programs. So we're going to have to do a lot of this virtually. I think, unfortunately, what that does is the most important part really of this entire process that we're talking about is the fit, and how does a student fit with the program? How does the program fit with the student? And how do we, fit together type of thing? And that's going to be much harder to sort of get through this interview season, just given that we're doing everything virtually. The other issue that's happening is that there are going to be some change in the dates and of when applications are coming out and when we start reviewing applications. The good news is that, there's going to be less of an issue in terms of travel and making flight arrangements. But it sounds like the dean's letters are going to be coming out a little bit later. And it sounds like programs may not have access to all the information that they would normally get to review applications until a little bit later on, which just means that the process is going to sort of, come to a head quickly, probably the middle to the end of October. And then that's probably where the invitations are going to start coming out for medical students. I think those are sort of again, this is going to be done in a virtual fashion for the first time ever, at least in my memory. And so that's going to make it very difficult for students to assess programs. And frankly, it's going to make it more difficult for us to assess the applicant.
And I think you bring up some interesting points and more to be discussed about finding out more information about our program, determining good fit. And then I think at some point we'll have a discussion about how applications are going to be reviewed and how each of the programs are looking at this from a holistic process. I just want to turn to you now, Dan. Can you talk about, as an incoming program director, how you're preparing for this application cycle?
Yeah, I think as much as I think there's a lot of anxiety on the part of the students, I think that you should all rest assured that we're also a little bit anxious, because this will be our first time kind of going through this experience in this virtual platform as well. I think that right now, in terms of preparation, I think we are thinking about ways that we can transmit information to you in a virtual platform in ways that we haven't necessarily done before. So you won't have the experience of an away rotation to spend a month with us. So how can we give our programs, the environment of our program and the people, and how do we deliver that same message to you through different media? So I would say, I think as a student, I'd be watching the social media presence of a lot of programs. I think that's probably gonna enhance a bit this year. I think also since we will lose that ability to meet people in person, either on the rotations and potentially on the interview day, we're going to be looking at paper applications in a way that's a little bit different. And I think really trying to find some of the unique aspects of you as an individual on paper. And so being really attentive to that really kind of holistic approach that we'll talk about later, I think. But how do you represent yourself on paper, and how do I screen in a way that's going to really try and pick out some of the interpersonal things that we won't be capturing in person. And I think we're also anticipating that we might get more applications. And so we also have to strategize about how to do that in a timely fashion, especially as things are starting later. And so how do we screen, how do we divide, and really make sure that we get through everybody and make sure that everybody's got a fair shot at getting their application reviewed by everybody.
Thank you for sharing that. And it's interesting, the concern about application numbers with the number of programs that students are applying to has gone up tremendously over the past few years. And I know there's a lot of angst that students may be having and considering applying to more programs because they want to have that opportunity to apply to more programs to improve their chances of getting interviews and to get into a program in emergency medicine. And I want to turn to you, Adaira, and can you just tell me what some of the other concerns that students may be having as they consider the application cycle this upcoming year, in addition to applying to more programs?
Yeah, I mean, I think probably the biggest concern has already been addressed, which is completely understandable. I mean, I really understand the sentiment of the students who have reached out to me regarding their levels of anxiety and this lack of control. I can imagine that being frightening, especially when it comes to trying to find a rotation, which we know in the past has been very valuable for us on the assessment side from residency leadership. And so I think that's the biggest thing that they're concerned about is how am I going to be able to get an audition or an away rotation secured? And when will that timing be for me as well? But I think the other things are because of that lack of ability to get your traditional away rotations or even your in-house rotations, people might be nervous about how they're going to be able to get their letters of recommendation because those tend to be married to each other. And so, typically, at least for us, we see up, 3 to 4 letters of recommendation submitted. And so how are you going to be able to get all of those letters if you only have, let's say, 1 rotation? I think that can be nerve-wracking for students as well. The last thing would be how our interview is going to occur. And maybe some people might not be comfortable with the idea of it being completely virtual because of the absence of being able to see the intricate details of a program that are going to be lost if it's just one-on-one interviewing the entire time. I think those are probably the major concerns for students, the rotations, letters of recommendation, and how the interview process will look.
Thank you. And so one of the things that the Visiting Clerkship Program is done for our residency programs is allowed students from diverse backgrounds to have an opportunity to rotate at our teaching hospitals. And it's been an excellent way for us to identify students to come to our programs and increase our diversity amongst the residencies. And I want to talk a little bit about the importance of diversity and what our residency programs are doing to increase that. And so I want to turn to you, Leslie. And can you tell me what BIDMC is doing to promote diversity in their residency program?
Absolutely. And for those of you, I know our introductions were a few minutes ago. I'm the Associate Program Director at the Beth Israel Hammer Program. I also had the honor of training at BI. So I have a long-standing history there, and our department and residency team is absolutely committed to increasing both the diversity of our residents and faculty. Most notably in the past few years, we've established a diversity and inclusion committee, of which I'm a member, and I'm also a co-founder of our Women in Emergency Medicine group. Our department has been incredibly supportive, both with promoting involvement as well as with funding our programs. And we've seen a real increase in terms of residents and faculty involved in both committees. We have been striving to increase our fellowship training opportunities and creating new leadership faculty roles to also develop and increase our diversity within our faculty. We love having our visiting students. We're so sad we don't get to meet you in person, but thank you for joining us virtually. We've had tremendous relationships in the past with our VCP students and involved in the showcase, so we're hoping to continue our virtual presence. Finally, we do have a wellness committee, which is really important to support a diverse group of interests and a good way to get our residents and faculty together. Currently, we're doing most things virtually and using Zoom for our social get-togethers, but it's an important thread throughout our department and really creates a bond between our residents and faculty.
And Adaira, I want to ask you the same question. Can you tell us what the Brigham MGH program is doing to promote diversity?
Yes. So just starting from like the top down. So I am the chair of our diversity and inclusion committee within our department. This was started about a year ago, and what we have focused on is trying to recruit faculty members over the last year. And we've been actually very successful with that and have actually put out offers to many people, and some have accepted, which is really great and actually a large improvement compared to prior years as far as how many people we were able to recruit to join our team. So we're really gearing towards the idea of recruiting faculty, because I think that really greatly affects how residents view a department when they see themselves in the department at the level of a faculty member. At the resident level, what we have done, I mentioned this earlier, is we created this Hammer Roots initiative, which is really resident driven, but it's faculty mentored as supported as well. I'm one of the faculty members who supports the program. They focus again on the recruitment of underrepresented minorities through the interview process, and they have created many ways to reach out to the applicant pool, either before the interview, during the interview day, and after interviews. And then the other thing from the residency leadership side is we've actually done training on recognizing bias when it comes to doing our review and making sure that we're being very fair to candidates across the board. We want to actually start incorporating more of our initiatives into our Hammer website, and mentioning that, you know, diversity is not just focusing on underrepresented minorities, but it's also people with different ability levels, the LGBT community, supporting our mothers and our fathers who are in the department as well, and just being very, very openly and clear regarding that we support all walks of life, we support people, and that they all are valuable to our community.
Wonderful. And sticking with you, Adaira, I want to just get a better understanding of the audience. I know there's a number of students in here who are 100% committed to careers in emergency medicine, but there may be some that are in our that are listening into our webinar who are a little unsure about emergency medicine as the right training opportunity for them and the right career option for them. And so, can you tell us your thoughts on how students can identify if EM is the right specialty for them? And what tips do you have for students as they try and whittle down their list? Maybe they have 2 or 3 things that they're considering for residency programs, what they can do to really define which specialty is going to be right for them.
Yeah, it is unfortunate that some of the students who were going to try to do a couple of different rotations between February and March or so weren't able to, or April weren't able to do that, because that's where most people decide if they're teetering. So now you have to decide from the outside, meaning outside of the clinical setting, which field is best for you. I think in this scenario, really the currency is people. So trying to get to know people who are in the field and asking them questions that are sometimes uncomfortable, because you really need to know what are the highs and what are the lows, and you need to know the extremes of both. And if you as a person would be able to consistently expose yourselves to the extremes of the field. So I think the day-to-day, you know, seeing someone with ankle sprain, with an appendicitis, like that doesn't necessarily take an emotional toll on you, but I think the extremes of emergency medicine can. And so asking yourself those sorts of questions, like, can I deal with all of the heightened emotions and then going to the lows right away and the back and forth of that? I think COVID has brought out a lot of what emergency medicine looks like. It's like the first time it's at the forefront of the consciousness of America, and people are really recognizing what it is that we do, which is amazing. I mean, this is like the first time ever emergency medicine has been in the limelight, which is so great. But there's so many other things in addition to that that we're not talking about, like the changes in salary, how our shifts have been changed because of that, our fears of being exposed and our health being like at risk, like all these other things. Really, you're going to find the answers by having deep and possibly difficult questions, but you owe it to yourself to be able to do this and to feel comfortable doing this. So ask questions, get to know people, get on Twitter. Twitter is so amazing. You can reach out to people all the time that way and just ask them questions.
Wonderful. And Leslie, I want to talk to you because this is a concern. I'm looking at the questions that students are submitting, and it's, you know, many students are typically use away rotations to learn about programs, but they're not going to be able to do so in the foreseeable future. Many institutions have suspended programs for away rotations at minimum until September. At least that's what we're doing here at HMS, but other institutions have canceled them for the entire season, academic season. And so what can students do to research programs and learn more about programs since they won't be able to do their away rotations there?
Absolutely. There's many options to learn more about a program. Of course, a website will give you the specifics of curricular details, rotation sites, what the program looks like. For example, is it 3 versus 4 years? How much elective time do you have? What types of sites do the residents rotate at? And that is going to be a big thing to consider, whether you want more community practice, tertiary care, trauma centers versus county centers. And those are things to look at from the website. But I think two of the best ways to get an idea for the program: number one, reach out to faculty or residents. Everyone's contact information is listed on our website. When I was interested in BI as a medical student, I reached out to a former Georgetown alum, because that's where I was going to medical school. He was a current senior at BI, and he told me how much he loved it. And that was a connection I just made via email and reached out to someone who I had a similar background to. So that's definitely one option. And the other way is to look at a program's social media. That's the best way to see what's going on up to date, especially in the current COVID pandemic, we're constantly updating with new publications, new research trials, things that are changing at our hospital. And in normal times, a lot of social events, resident photos, wellness committee events, and ways to show how a residency really bonds together. So using social media, using contacts that you find at the program, and then of course going to the website to get the nuts and bolts of each program. Check us out on Twitter at BIDMCEM because I run it.
I love it. Shameless plug. Nothing wrong with that. You know, Dan, we're hearing this discussion about learning about programs. And there's what you read, and then there's also what you see on other spaces, maybe some internet blog sites that may or may not put programs in their best light. But can you talk a little bit more about how students can learn more about the culture of a program without actually being there in person?
Yeah, I think, you know, I think you've heard several tips already that are relevant to this. You know, I think the culture of a program is really just kind of what's pervasive in the environment and what are the people like. It's something obvious to everyone who's there, but again, from the outsider perspective, it may not be obvious. And so I think, I do think that one of the places to start is the website. And while the website definitely is a place that programs will give you their sort of standard curricula and the things that, you know, they want to tell you about salary and all those other things, I think there are places that are intentional about what is included on their website, right? So if you see that, you know, wellness is featured, if you see that diversity is featured, if you see that research is featured, and you see things related to the resident life, I think that kind of starts to paint a picture of what the culture of the place might be like. I think the social media piece is increasingly important, and certainly this year, I think you'll see lots of places enhancing what they're exposing on social media related to culture, since we're in this new virtual space. And the other thing, I think, kind of like what Dr. Bilello said, I think speaking with people from your school who have gone to that program, or even people who graduated this past year who have recently been on the interview trail, will give you a lot of insight into what the place is like. And so I would start to reach out to those people and find out where they interviewed and some thoughts that they might have had, particularly as somebody from your own institution where you sort of speak the same language and you kind of understand each other's personality a little bit. I think it's really helpful to have that connection. And then similarly, if you're at a place that has an academic department, speaking to faculty at your place who have trained in the places where you might be interested in, because they will give you insight into this culture piece, which is somewhat intangible and can't really be expressed well on paper. And I think that, you know, they'll give you the sort of honest answer, and they'll, you know, interview season is kind of showtime, right? And so we're all putting on our best performance in this time. And so it's really helpful to have those kind of inside connections to people that are similar to you and in a similar space that you're in right now, to be able to give you some better information.
And Carlos, similar question. How do you feel when you receive an email or two from a student asking questions about a program or asking to be connected with a resident or a faculty member?
I think this year, that type of communication is going to be very important. And I think absolutely, you know, reaching out to the program director, reaching out to residents, you know, again, the place to get your information about a program is going to be from the residents at the program. And again, if you have upperclassmen who have graduated and certainly just went through this process, those are great places for information. And again, reach out to residents at the program. We are definitely going to be sort of facilitating communication between applicants and residents, current residents, and then also faculty as well. So again, and the other part of it again is that, you know, as Dan mentioned, we're anticipating that the numbers of applications are going to be up. What is going to be hard, again, is to figure out the fit. You know, do you fit into a program, you know, and are you a fit for my program? And so, you know, one of the ways that we're going to, you know, we always look for people that are interested specifically in being in our program, because again, they think they're a good fit. We think they're a good fit as well. So that communication is going to be important. So if you have programs that, you know, I wouldn't do this with every single program, obviously, but if you have a couple of programs that you're really interested in, do your best to reach out to them and let them know and be specific about why you're interested in that program, that geographical area, and or that specific program.
And a pro tip for all the students that are out there, make sure that when you do send these emails out, you are paying attention as to who you're emailing and the content of the email, and so that it's specific to the program. We've seen errors where students have sent emails to one program and mentioned another program in the body of the email, so don't make that mistake. And so next, I want to start talking about some of the experiences that students are having during this COVID era. And unfortunately, a number of students had electives that were interrupted, and some of them may be those core electives that you all as program directors may be evaluating. And so Leslie, what are you all going to do in evaluating students whose third-year clinical time was interrupted by this COVID era?
We know this is a stressful time for you all. And as Dr. Egan had mentioned, this is some uncharted territories for us as well. So we're going to be working to have a holistic, multifaceted approach that's a little bit new compared to prior years. We've always tried to look at the whole package that an application presents, but this year is going to face some challenges with third-year rotations being interrupted. You do have your core rotations. Generally, those are looked at as pediatrics, surgery, internal medicine, and OBGYN. If you were able to complete a portion of your core rotations, that will be helpful for us to see how you performed in a clinical setting. But otherwise, we have a lot of other facets to look at, including your previous work as a student, your EM letters and grades. Of course, that may be a little bit limited to home institutions this year, but everyone's going to be in the same boat. We look at your extracurricular activities, some of your board evaluations, and your academic experience. So we really take a holistic, multifaceted approach. And if you were not able to complete all of your core third-year rotations, we don't want you to panic. We are looking at this with a new light and under the lens of the COVID pandemic and what it's restricted our applicants to doing in the clinical setting.
Thank you for that. And Adaira, a similar question. Students would typically be getting ready to do their audition rotations or away rotations for residency. And it's been something that's been sort of really cultivated over the years in emergency medicine, but we've pretty much lost that opportunity. And so based off of your knowledge and your experiences, what should students be doing if they were thinking about away rotations or if they don't have an away rotation because they know that it's already been canceled?
I mean, I think a lot of it's already been said, but the one thing that I'm going to try to hit home is that even though away rotations will be canceled for the majority of us, and many of our students will have their own home rotation that they can just sort of rely on, not all students have that luxury. And so if you are at a program that does not have a home institution for you to rotate, or that does not have a program within emergency medicine for you to rotate through, then I would not sit still and wait for someone to reach out to you in 2 months or in 3 months and say, oh, by the way, you never signed up. I would actually get engaged with someone from your medical school. Maybe it's the registrar's office as the start, just to say, I'm interested in emergency medicine. There's no rotation here within my department or my hospital system. What can I do? How can I go to a neighboring program down the street or an hour away, just so that I can get one experience rotating within an emergency department? Because you definitely want some experience doing the sub-I. It just might not be at your home hospital. So get engaged. Please don't be too idle, and make sure you stay on top of that.
And just for clarification for the students who are listening, if you're at an institution that does not have an emergency medicine rotation that you can do as part of your training and preparation for graduation, you will likely have opportunities to do away rotations. They are still trying to finalize the language and the verbiage that will go into this, but for students who are at institutions that don't have rotations, there's a chance that there may be experiences available for you. All those details will come into light as we get more information and as you hear more from the AAMC, ERAS, and NRMP. Carlo, a part of away rotations has always been the SLOE. And now that students are not able to do those away rotations and get that outside validation that many programs would look for, what should students do when they're considering those 3 or 4 letters of recommendation that they want to have attached to their application? Can they consider letters from other specialties? Can they consider letters from their research mentors? What should students be doing to get those letters?
I would say that, get a letter from the places that you have rotated. And obviously those numbers are going to be down overall. Certainly getting other letters from other clinical faculty and other specialties is going to be your backup. So, surgery, the ICU, medical sub-internship faculty would probably be good people to write the second letter for you. And that's sort of, again, and certainly research, I think, is going to be helpful for certain programs, but again, I would say the first two should be, clinical, ideally from one EM rotation, and then a second one from an off-service, different specialty.
And Dan, I have a question for you. I've seen this come up in a couple of different spaces where there may be some mixed information because students are concerned that having 2 or 3 slows is actually a bad thing, or having an away rotation, more than one away rotation, makes them look like they're trying to be an overachiever. And so any thoughts about sort of trying to thread the needle appropriately and making your application look the best going forward?
Yeah, I think hopefully we'll be getting some more formal guidance on this soon in terms of actual away rotation so that all of you are not faced with having to kind of make that decision on your own. I do think there's going to be a balance of exactly what you just said of not trying to be an overachiever, but I think there are some things that you can do even on your own that's not necessarily an away rotation. But so for example, if you do have a tox rotation at your place or an ultrasound rotation, those are totally appropriate for EM. And I think that those would just be ways to, again, show your enthusiasm for the specialty, get a little bit more exposure to direct time with EM faculty members who can provide some support for you in a letter. And then I would also just say to kind of watch the CORD space, which is the Residency Director Association. I think everybody's nervous about the SLO in general. And there's talks of making a modified SLO for people from other specialties to potentially use as a framework for their letters to help sort of highlight the pieces that we're interested in emergency medicine. So I think, sticking with whatever the ultimate guideline is, if it comes out and says everybody should just have one sort of EM sub-I SLO, I would not try to deviate from that if that's ultimately what we say. But I think other specialty specific things are appropriate and would, in my opinion, would show that you're really interested in. Again, it's another voice from an EM faculty member who could lend some credit to your application.
Great, thank you. And Leslie, one of the major components of the application that is for sometimes overlooked is the personal statement. Right now, people are having their various experiences with COVID and how it may be impacting them personally or how it may be impacting their families. Can you talk a little bit more about what students should be thinking about when crafting their personal statement? And then also, trying not to sound, how students can try and differentiate themselves when writing their personal statement to truly explain who they are. And then lastly, how much should they talk about COVID if they talk about it at all?
I think this is a great question and one we should definitely touch upon. We receive hundreds of personal statements each year. It's important to keep them brief and to the point and as personal as it can get for us to get a glimpse of who you are as an applicant. It's going to be more important this year than ever before because of the limitations of meeting in person. So I think it's a great opportunity to showcase who you are and how you fit into emergency medicine and our program. While we're all bonded by this COVID experience, self-isolation, quarantine, and kind of the fears that we've all experienced, it's not the best way to make yourself stand out to include it in your personal statement. Of course, we're all having our own experience, but I think leaving the COVID experience and pandemic out of your personal statement would actually be more positive and would make you stand out more as an applicant. I had a great advisor when I was a student, and I showed up to my first meeting with a page and a half of a single space personal statement. And she said, well, next time you come back, this needs to be half a page. And your first sentence needs to be the most eye-catching so someone's interested in reading it. At first, I was very upset because I had taken so much time curating my beautiful personal statement, but she was absolutely correct. Keep it brief, to the point, and I recommend having a first sentence that really grabs the attention of the applicant reviewer. And that's a great way to make yourself stand out and be unique in a pool of applicants that we're only going to meet virtually this year.
Great, thank you. And so I want to dive into this other hotspot, just seeing a number of questions that are popping up in this discussion, and really want to talk about the STEP exams and how students have been impacted by this. I think one common question that happens even without dealing with COVID issues is how students may overcome a poor Step 1 score or maybe even a weak core clerkship score and still get into a competitive residency. And so Dan, what are your thoughts on how students can overcome a poor performance in one part of their application?
Yeah, so I think unfortunately still Step 1 remains one of the only kind of objective, really student to student comparison metrics we have. And as you know, that's going to change in the future, but for this year, we do have that. And so the reality is that there will be a number of places that will look at that and kind of use that in determining whether or not to invite someone for an interview. That being said, there's lots of ways to overcome performance that isn't that great on Step 1. I think by far, if you talk to program directors, really much more than Step 1 is how you did on your EM clerkship. And so really preparing for that and just blowing that rotation out of the water and doing really well is going to speak much more to a program director who has the validity of another EM person that you can do well in the department. We can coach people on test taking. We can coach people on how to do well on an exam. If you're doing well in the department, at the end of the day, that's what we want, is someone who's going to be a great clinician taking care of patients. And we can get the resources together to help you if it's a test taking issue. Similarly, on the core clerkships, I think there's two things I would say. One is that if it's because of the shelf exam, I think that's a similar piece, right? If the shelf was just 40% of your grade and it was the shelf that brought your grade down, we can see that. The other piece is that one rotation is not everything, right? And so if you did well on the other ones and then again did well on your EM rotation, it's again a point of forgiveness. I would say that if Step 1 isn't that great, I think Step 2 is an opportunity to sort of shine a little bit. Of course, we're all a little bit uncertain about what's happening with Prometric, but Step 2 is much more clinically relevant to emergency medicine. And so I think we're all way forgiving on sort of the preclinical test if you've done better on Step 2. And then I would also just say to be attentive to what's in your dean's letter about your rotation. So if there was a rotation, and you'll see your dean's letters and what they're going to write about why that performance wasn't great in that rotation, be ready to talk about it and potentially even address it in your personal statement as an opportunity to sort of give us an explanation as to why it maybe didn't go as well as you had hoped. And certainly just to really strive for a superstar performance when you do your EM clerkship, which is really, at the end of the day, what we're looking for in residents.
And Carla, I want to turn to you. Dan alluded to this earlier, talking about Step 2. But can you talk about the importance of having Step 2 as a part of your application prior to submitting your application at the end of October? There's some students that had Step 2 dates that were scheduled and have been canceled, specifically for the clinical knowledge portion of the exam. And then there's a lot of uncertainty about what's going to happen with clinical skills, whether it's going to be proctored at certain institutions or whether it's going to be in a telehealth format. So based off of your experiences as a program director, what are you going to do in looking at Step 2 as part of the application process?
So I would not worry about Step 2 scores. I think if you can, if you have them, great. As Dan said, I think definitely if you do not do well in Step 1, a lot of times people will want to use Step 2 to sort of boost that Step 1 performance. But realize that I'm not going to use Step 2 to judge across the board all of the applicants, because not everyone has it. So that wouldn't be fair to do. So there are places that are going to look at the Step 1 score. And eventually we may look at the Step 2 score, but I would not, it's not a very important part of the application. So I wouldn't worry if you can't get it done.
And anything to say about the clinical skills portion of the exam?
Again, not a major part of the application for us. So I would not worry. I mean, you got to do it obviously, but I wouldn't worry about it if you can't get it done before most of the application is in.
Okay, Thank you. And then, you know, as we're preparing for the next phase, right? So the students have done their research on the programs. They've reached out to program directors and to faculty and gotten to know a little bit more about their programs and expressed their interest. They've created their applications with strong letters and a strong personal statement. And now they're at the interview phase of this process. So Adaira, what can students do to prepare for virtual interviews? We're anticipating that interviews will be virtual. We are hoping to do them in person, but in all likelihood, we're still waiting on what the AAMC and ERAS and NRMP has to say about this. But what can students do to prepare for virtual interviews should that be the norm for this application season?
So I guess I'll first off by saying how are we preparing for it from the residency leadership side. So this will probably evolve as we get some guidance and some general practice and strategies from national organizations. We just got some formalized documentation that they're suggesting we move to virtual interviews. I can't imagine with everything going on that people will still be doing a normal in-person round of interviews this season. So I think getting into the mindset that likely this will be virtual is probably the first step for us as well as the medical students. Concepts that kind of come in mind as we structure this would be, I think the first thing is the timing. You know, we generally have a very like rigid way of scheduling these interviews because that's when people are available during the day. I think now with COVID, the business day is very vague and the boundaries are unclear. And so when we will be timing these and the length of these interviews will be quite different, I would imagine, as well as the amount. Like, will we still do eight interviews per applicant, or will we scale that down or scale that up? People definitely get a level of fatigue staring at a camera that they might not get in the in-person interviews. And so that might factor into how they perform. I think the other thing would be the content of what is covered during the interviews. I would say, generally speaking, in our program, we do this sort of free-form model where the interviewer can just ask whatever they want, I mean, within certain boundaries, but they can ask whatever they want. But given the fact that everything is different and we're going to have so many new ways of evaluating medical students that we didn't have to think about before, will we actually structure the interviews by giving the interviewers a framework of making sure that you assess these things that we can't assess otherwise, let's say during a visiting and rotation. And then probably the last thing the second to last is the weight of these. Will interviews matter more? I don't think that's quite clear yet. And I think we probably will have to test it out and see, like, how are people performing? Because it might be that everyone is nervous, or that it's hard to engage and have that level of connection that you can get from an in-person experience. I think one thing that will be a struggle will be, how can we replicate the social aspect of the interview day? I don't think any of us have been conditioned to socialize in a virtual aspect. Most of us look for body language, look for positioning, look for eye contact, and that's really hard to do even as I'm speaking to you right now. So how are we going to replicate that level of socializing with residents, with faculty members, in a way that really lets them understand the culture?
Thank you. That's a great framework on how a program may be approaching this. And Leslie, can you talk about how students can be approaching virtual interviews?
The most important advice I can give is, even though this is virtual, you still want to be professional. You may feel very comfortable in your own home, and it's tempting to interview from your couch, probably with some sweatpants and slippers on the bottom, throw on a blazer on top. But really, I think to get yourself in the right framework, find a quiet place where you have a professional background, you're dressed professionally, I would say from head to toe, so you get yourself feeling confident, feeling professional. And it's going to be important to practice. I would say find a faculty member or a family friend, someone you're not as comfortable with, say as a friend or your mom or dad, and practice with them on your virtual platform. Make sure your background is good, your lighting, and finally, just make sure your setup is comfortable for you. The most important thing to remember, although we are looking to get to know you, this is your opportunity to get to know some faculty at the program. So it's very stressful to be the interviewee, but just remember it goes both ways. We're trying to get to know you and also give you an opportunity to ask questions. So don't feel overly stressed by it. Just remember that it's a great opportunity to ask the questions you want to know and get to know who your faculty and residency leadership is going to be over the next 3 to 4 years.
And then, you know, another portion of this conversation is always the sort of after the fact conversations and connections that a student may have with the program. And so, again, assuming that all of this is going to be virtual, any thoughts, Carlo, on how students should go about with communicating with residency programs? Should they not receive an interview on first glance and still have high levels of interest in the program? What should they do to engage a program to show that they are truly interested in spite of either being waitlisted or told that they were declined for an interview?
So the student can either send the program director an email directly. And again, you know, basically put down sort of reasons why they're interested in the specific program. The other thing you can do also is get in touch with your advisor and have the advisor reach out to the program director at another program. And again, that's just sort of a higher level of significance. And, you know, maybe that advisor can speak about you and also, again, can reinforce that, you know, you're born at my hospital, you've been dying to come back and train at my hospital, you love the Red Sox. So those are all important things to consider as well.
Okay, and similar question I'd love to ask you, Dan, what is your thoughts on this, on communicating with programs if they don't get offered an interview or they're not, they're put on the wait list?
Yeah, I totally agree with everything that that Carla just said. I think I think you sort of alluded to it before, but I'll just re-emphasize that pro tip thing about the emails. We get a lot of them. And so one, I would just say, please, you know, don't be disheartened if you don't hear back right away or potentially even ever, unfortunately. But we get a lot of emails on a daily basis during the peak of the season. I would just say, be careful with your cut and paste. Be careful that the font of the program name is the same as the rest of the text, because those things stand out really dramatically. But specific things that have to do with the program and why you want to be there, I think are incredibly helpful. And absolutely having an advocate, either the program director at your own place, your advisor, me hearing from that person and vouching for you in a way that's different than I can see in an email is actually really helpful. And then the other pro tip I would say is I would advocate against cold calling. I've had many times where my phone is ringing in the office and it's a potential applicant, and it sort of kind of catches me by surprise, or the coordinator. I'm not sure that there's a lot of value in sort of putting the PD on the spot by phone. I'm not really going to do a pre-interview interview. So I think, you know, professionalism speaks volumes here, and sort of etiquette speaks volumes. But I do think there's no reason that you shouldn't advocate for yourself, especially if you haven't heard from a place that you're really interested in.
Yeah. So I want to try and sneak in a couple questions from the audience, but I got a quick question for you, Leslie, since you trained at BI. What do you love most about your program?
I loved my residency class. That was probably my favorite part. We were such a social group, and we were a 3-year residency that was fast-paced, action-packed, and it bonded us for life. It's my family now. We've spread out all over the country, but that's the type of resident that BI attracts. Hardworking, self-motivated, and just about everyone in my own class and the classes surrounding me have become leaderships in emergency medicine, whether it's in the academic realm or the community site. And just watching all of my co-residents succeed in whatever endeavor they chose after residency speaks volumes to the program.
And Dan, what brought you back to Brigham and Women's MGH residency program? Oh.
In some ways, it's a similar theme. I just made the Zoom error of the century. You know, I think I still have that very nostalgic feeling of wanting to go back to the place that trained me. And I think about my co-residents all the time. Many of the people that trained me are still on the faculty there. And there's just something really special about having the opportunity to go back and take the reins on the program. It's a place that I just vividly recall feeling just motivated to be better as a result of being there, because of my co-residents, because of the faculty, and the clinical pathology is just awesome. But it was kind of my dream to come back someday and to be part of the program again.
Well, I'm sure they're glad to have you back. Hey Carlo, this is a question from the audience that I'd like to get some insight on. We talked about this a little bit in letters of recommendation. But is there a format or some content that non-EM faculty should consider using when creating a letter of recommendation that helps to speak about the potential for an applicant being a great EM doctor?
Well, I think it sounds like Cord may be developing this modified SLOE, which sounds like a great idea. I haven't seen it yet, but certainly what we look for, is basically sort of how this person is done clinically on these other rotations, and sort of try to be as objective as possible, and certainly compare this person to other peers, I think would be helpful. Certainly if you can anyone can take a look at the SLOE, which is on the Cord website, and match the sort of objective nature of it in a letter, that would be easy enough to do.
Great. And Adaira, we had talked about this a few times about how students can even earlier potentially engage with programs if there's opportunities to participate in virtual journal clubs or to participate in resident lectures virtually. Any thoughts on how that may help a student get to know a little bit more about a program, or have you heard of any programs that are offering that?
I think it's a great thought. Yes, and we have talked about it. I think many places are talking about it or thinking about it. I would say from the student standpoint, you probably have some time before you engage with programs and reach out to them, because I think a lot of us are still just trying to digest the information that's coming from a lot of the national organizations or within our own internal groups as far as how we are going to approach this interview season. So I think my first thought is to be a little bit patient as far as reaching out to programs and seeing how you can engage. It's still pretty early. I assume that as folks start to develop some way to interact with potential applicants, they will reach out or put something on their website. So feel free to continue to visit those websites. I would say as we enter the summer or so, I think that's a great time to reach out to a program and say, I'm really interested in your program. I haven't been able to rotate. I would love to know if there's any way for me to engage with your faculty or with your residents. And you don't have to do this for all programs. In fact, I don't recommend that, because you're gonna have to follow up with all of those replies. So if someone says, yes, you can come actually next Thursday or in 2 weeks, you don't wanna say, oh no, I can't do that for every single place. So I think, keeping it short and simple with your list as far as who you reach out to is probably a smart idea as far, when I'm thinking about your capacity to follow up on things. But also keeping in mind, give us some time to figure out how we can best engage you. I think it's a little early right now. We definitely don't have a plan in place, but I think we will coming soon as far as how applicants can, come to our journal club, come to our typical didactic conference. We are probably going to have some special social events, I assume, that would be outside of conference day, outside of interview season, that will allow students to interact with residents, but all that will be forthcoming. It'll all be on our website. So you can always come back and reach out on a regular basis by just clicking on that link, hammer.org.
And Leslie, I'm seeing a couple of questions that have popped up with people having concerns about the number of programs to apply to. They're concerned about under applying or over applying. And I know it's not an easy way to, there's no easy answer to this. And there's no way for us to say, you need to apply to X number of programs to guarantee that you'll get enough interviews and you'll match. But any thoughts on what students should do to make sure that they're applying to an appropriate range of programs?
There's no perfect number, and it's a great question that we're all going to be figuring out together during this very unique application year. If you are trying to apply outside of your geographic area, say you are from Massachusetts and you want to get out to California, you're probably going to be applying to a lot more programs, as opposed to if you're just keeping a very small catchment area and you want to stay in X city. I would just caution you not to panic and not to over apply. We're still going to be able to interview applicants, but if anything, we're going to be able to accommodate more applicants because we have a virtual interview season on the horizon. So I don't want anyone to panic. I also don't want anyone to be applying outside of what they can comfortably do on ERAS, because I certainly remember looking at my list and seeing kind of the costs add up Don't panic, apply to the programs you truly want to go to. And again, if you're looking at a broader area, you're going to end up applying more. Whereas if you're saying, I just want to stay in this city or just want to be in the Northeast, be true to yourself. Don't apply to programs that you're not actually interested in. Again, we will be able to accommodate. And if anything, we'll accommodate more interviews because we're virtual.
And Dan, I would love to get your thoughts on this. When I was an applying student, I benefited from doing an away rotation and having the ability to come up from Alabama to Boston and do an away rotation. But again, students aren't going to have this opportunity. So from a geographic perspective, you know, can you talk a little bit more about looking at programs, looking at places that may be a good fit for you and the type of training that you're looking for, and then communicating what you would recommend for students to do to communicate their interest in those programs if they're coming from a different geographic area?
Yeah, I think, you know, one of the goals of a program director is to have residents who want to be in your program, right? So if you have people that want to be there and they're happy to be there, that makes happy residents, that makes happy PD, that makes happy faculty. And so if there's something compelling about the program, then I think it's worth reaching out and talking about that. You know, I think it's going to be a little tricky. If you've never been to the city before, what it's like, there's certainly feels of different cities. I would say that there are also feels to sort of how EM is in different parts of the country. And I think using your resources of people who have trained in those different cities, I think is going to be really increasingly valuable this year. And there are places that are super heavy on trauma and penetrating trauma, and there are places that are not. And so I think starting to really evaluate which of those things is important to you, because as you have to make a sort of mental model of what things are going to be at the top of your list without having seen them, I think those things are going to weigh a little bit more for you. So, you know, if you've not been able to see a city, you know, I don't know if you can take a secret trip to the city and not do the interview, but we can't advise that. But you know, I do think really trying to get in touch with people who have lived there, who have been there, and to not forget that it is a risk to go to a new place. I mean, places are very supportive, and you're going to immediately have a family in your residency. But you know, your social network and your support system is really important, and not to minimize those things, especially as times are a little bit weird right now. Making sure that you're choosing a location that's going to be good for you as a person in sort of going through this journey for the next couple of years.
Great. And, you know, this is a question that I've seen in a couple of different spaces, and I think it's really important for us to talk about here. One of the ways to assess the culture of a program and to understand it is to look at the program in times of distress. And obviously, COVID is a time of distress for all residency programs. And so I think, I guess, what have you noticed about your residents during this time? And I'll go to you, Carlo, and then I'll go to you, Adaira, for this question. So thoughts about the residents and how they've reacted to this COVID pandemic.
Well, I'll be honest. I mean, I don't get emotional too frequently. You know that, Alden, about me. But I will say that this time has really shown me the strength of my residents and how they sort of look out for each other. We do have a whole lot of sort of wellness check-ins with them recently, you know, during these weeks. And I think the quote that sort of sums it up for me is, you know, what's the biggest hit to the residents right now? And one of my graduating seniors said, I miss my homies. I miss being able to hang out, you know, with the group and socialize with the group. And I think sort of what, you know, Leslie alluded to this, that we try to foster a very cohesive, you know, respectful group of residents. And I think that's really, you know, what people are doing now during these times is sort of working together, diving in to take care of patients clinically. Well, that's what we do for a living, and looking out for each other.
And Adaira, what are your thoughts on that question?
You know, one thing that has been revealed to me, I think, is the humanism, the humanity that exists amongst our residents. I have been so impressed seeing people demonstrate both their drive to help others, as well as recognizing their own personal fear, and how those two things can coexist, and that is a natural process. I really loved living or watching our residents sort of live through this and have that sort of up and down as far as their emotional status, because I think this is a lot for anyone to take in, and especially so for those who are just trying and training to become a doctor, it's even more for them. And so I have really loved seeing them mature, and I think a lot of them have grown tremendously over these few months. I think it's quite impressive. I mentioned a bit earlier about how, I think for the first time, emergency medicine is really at the forefront of America's consciousness. This was actually told to me by the program director at Seattle. I should credit her, because it really did, I think, open up my residents' eyes as far as like, oh my God, this is what I trained to do. This is why I'm here, but also being able to recognize that I'm actually afraid of what does this mean for me and my family and all those things. So it's actually been really remarkable.
Great. And I see that we have about 4 minutes left. So I just want to ask both Dan and Leslie this last question. Is there any other piece of information that we haven't talked about that you think that the students should know? What small piece of advice that can potentially help them just to deal with the duress that's happening with this application phase? Go to you first, Leslie.
My advice that I got from one of my advisors is to remember that you're in the driver's seat for where you want to end up training, what you want to do with your life. You're all going to be great applicants, and you're going to find the home that fits you correctly. That's going to be a little bit more challenging this year because you won't be able to visit us in person, but you will find your place. You will find your amazing residency class, your leadership team, and all go on to train to be great physicians. This is a challenging time, but if you can be resilient through it, it's going to make you a stronger resident and physician in the future.
Wonderful. And Dan, any parting comments?
Yeah, I love that. I think I often say the match works, so I think put your faith in this process, but also it feels incredibly personal right now. Like this is happening to you, but really it's happening to all of us. And so as much as it's so anxiety provoking, I think if you can be at ease a little bit to know that everybody's really, the playing field has been leveled in a whole new way this year in terms of applications and this whole process. And so the struggle is really just for everybody. And I think you're all going to be going through a similar process. And then the only other piece of advice I would just say is really, you've got a little bit extra time now to put your application together. And I think really thinking hard about how you can tell your story in that application that makes you stand out as a unique individual is going to be really helpful to us this year. Just not having lost the ability to meet a whole bunch of people on away rotations. I think this is your chance to really get that unique factor in your application and really and showcase yourself as a person and sort of bringing that piece to the application.
Wonderful. Thank you for that, Dan. So we do have a couple of other pieces of information that we're going to share with you in our upcoming slides. So far, if you could bring back up the slides. But before we go any further, I just want to say thank you to Dan, Carlo, Leslie, and Adaira for participating in this panel, joining us, sharing your thoughts and insights, helping us to learn more about the two Harvard-affiliated emergency medicine residency programs. We're going to have your contact information available. There's more information that we will be posting regards to the application process. The Visiting Clerkship Program is going to continue to offer opportunities for students to engage with us in the form of advice around application process, developing personal statements. We're also going to do some discussions around living in Boston, and we're also going to have a discussion around preparing for interviews. All of that information will be coming up going forward. For those of you who have colleagues who are going to be graduating and applying to internal medicine residency programs on May 19th, we're going to do a similar program specifically targeted at the 5 internal medicine residency programs affiliated with Harvard. We're also going to do a conversation about surgical subspecialties in June, as well as OBGYN residencies. If you want more information or you want to keep up to date on the activities that we're doing, please look at the following Twitter handles and be sure to follow us on Twitter. We do have a poll that we would like you all to fill out. If you can bring that up, Fari, and then also go to the next slide. Again, this is just a reminder, even though we aren't able to host you for away rotations currently, we still want to make sure that you have support. So be sure to look at our website. And if you have any questions, be sure to reach out to us. I want to say a special thank you to Dr. Joan Reed for the 30 years of cultivating the Visiting Clerkship Program and being adaptive and creating this new space that we're in and using virtual formats to engage students as the VCP continues in a different format. And I want to say thank you to Fari for the organization of putting together this program. Please fill out the survey. The poll should have just popped up. And if you have any other questions, be sure to reach out to us. And again, thank you to our panelists and thank you to Fari for putting this on. And with that, we will end, and everybody have a good afternoon and good luck in the application process. And we look forward to seeing you likely virtually through our residency program interviews. Take care.